Facts about COVID-19 with Dr. Sumon Chakrabarti, Division Head Infectious Disease, Trillium Health Partners, Ontario, Canada. What is COVID-19, also known as the coronavirus?
Coronaviruses are not actually new. So about a third of the common colds are caused by other types of coronaviruses that have been around forever. But in the last about 10 to 15 years, we've seen a couple of special coronaviruses, including SARS in 2003, and now this, what we call SARS-CoV-2, or COVID-19, the new coronavirus. So this respiratory virus is one that is different in that, first of all, it's still very contagious, but it can cause severe disease, as we're seeing around the world. It's caused a pandemic, and it's important for us to understand what this virus does in order for us to combat it. It's been able to spread around the world quickly. It's contagious, so that's one thing. The other thing is that people don't have immunity to it, and that's why it's been able to spread quickly. So when you have a population that has some sort of immunity, the virus can then be curbed somewhat in terms of the speed that it spreads. So the combination of its contagiousness, its severity, and the fact that people don't have immunity because it's new is the reason why we're seeing it spread around the world, and that's why doctors and scientists are concerned.
Why is it important to wash your hands regularly?
So it's important to wash your hands regularly because you can get viral particles on your hand, which you can then introduce to your body. So by washing your hands, you reduce that risk. You can use anything from hand sanitizer to just regular soap and water. Both of these work.
Can you demonstrate the most effective way to wash your hands?
It doesn't have to be perfect, but there's certain things that I suggest. So first of all, you want to be able to rub your hands under the soap or the hand sanitizer. And then remember, you want to be able to wash off all of the soap if you're doing it with soap and water. If it's just the hand rub, that's it. What you're doing is you're trying to basically get to all the areas of your hands. So you're doing this kind of thing, get into the crevices, around the cuticles. You're trying to kind of get as much of the rub as much of the skin as possible to get any of the particles off and get the soap to the places that it needs to go.
The key is to wash your hands for minimally 20 to 30 seconds.
So that's why you want to do this type of thing. Okay? In doing that, you're increasing the chance that you're covering every little part of your hand.
Why is social distancing important?
Social distancing, which is an important thing that we've seen recently, is that we're trying to do whatever we can to reduce the people congregating in groups. And by doing that, you're reducing the person-to-person transmission, and hopefully we can curb this outbreak and flatten the curve, as you've been hearing.
Why do you recommend not touching your mouth and nose?
I know it's not always possible to avoid this, but the less you do it, rather, you are decreasing the risk of any viral particles in your hand, touching your nose and your mouth, where the virus can then enter the body.
What should you do if you're feeling unwell?
If you're feeling unwell, stay out of public. And I know, again, this sounds somewhat trivial, but it's important because if there's lots of people around who are feeling ill and they all stayed home, we're decreasing the risk of spreading it to others.
Remember, to protect yourself and others from COVID-19, take the following actions. Wash your hands thoroughly, continuously throughout the day. Remember to get into the crevices, the nail beds, and the full hands. The key is to wash your hands for minimally 20 to 30 seconds and use an alcohol-based hand sanitizer with a minimum of 60% alcohol. Washing hands is an effective way to protect yourself from the virus staying on your skin. Number 2, the importance of social distancing. This is an effective way to stop person-to-person transmission. This means keeping a minimum of 2 meters or 6 feet distance from people. If you must, only go out for essential requirements. Number 3, self-isolation. Is critical for anyone who's traveled or think they've been exposed to the virus. Go into immediate self-isolation, including from the people you live with. If you think you have the virus, follow your government-approved self-assessment protocol. And if you have those symptoms, call a healthcare professional or your local public health authority. Tell them your symptoms and follow their instructions. For more information on protecting yourself and others, please go to www.educateyourhealth.com because your health matters. Stay home, save lives. We'd like to thank Dr. Chakrabarti for his time and expertise and the work he and all healthcare professionals are doing.